Hello, this is Mary Granberry. I'm an insurance agent in the state of Texas. I am certified for the healthcare exchange plans as well as the small business shop plans. I'm here to give you the healthcare reform facts, how to enroll on the information, how to obtain the information so that you can enroll. Always review your options with an experienced healthcare benefits specialist. If you're in the state of Texas, you're welcome to contact me at the end of this video. All the facts and information are coming from the healthcare.gov website. There are three types of healthcare programs used today in our healthcare system: the government, Medicare, Medicaid, and the federal exchange plans, also known as Obamacare or the Affordable Health Care Act. Major medical, HMO, and PPO insurance is on the private market. These are offered by companies such as Blue Cross Blue Shield and Humana. They may also provide a major medical from your employer as well. Association healthcare benefits is something that can fill in the gaps of your major medical, or if you just want to go ahead and pay the penalty, which we'll cover in a minute, you can have the association healthcare benefits, and that will give you some coverage. It does not give you full coverage. The full coverage is going to come from the top two. To become a member of the association, which is the National Association of Preferred Providers, you're eligible to purchase any limited group medical, dental, life insurance benefits after a certain waiting period. It is $12 annually for the entire family. Let's cover the essential benefits that is what is making up the exchange programs and the PPOs and HMOs going forward in 2014. Every plan that is sold on the market today must contain these 10 things: ambulatory patient outpatient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, behavioral health treatment, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventative and wellness services, chronic disease management, pediatric services including oral and vision care. Now, note there is no adult oral or vision care covered under these plans. And also note that every plan must contain maternity and newborn. Does not matter whether you're male or female. If past childbearing years, anybody who has a health insurance policy must have all 10 of these things covered under their policy. Let's talk about the metal plans on the federal exchange plans. There's a cost-sharing feature which will be addressed in a separate rules with the determining actual retail value of a plan expressed in the metal levels. Understand that there's 4 different levels that you're going to be offered in coverage: bronze, silver, gold, and platinum. Bronze is going to cover you at 60% of your medical costs. That means you will have 40% out of pocket. The platinum is going to cover you at 90%. That leaves you 10% out of pocket. The federal poverty guidelines for the continental United States is made up of this. Your household size does not matter if you're roommates or whether you're married, you have children. That is how your household size is going to be determined. So even though you may file separate tax returns, it is going to be based on how many people live in that household at that particular address. So if you're 100% of poverty level, that means your income is $11,490. Anything in the 100% guidelines, you're going to be directed to Medicaid. So before going any further, if you fall into the 100%, know that you're going to go and apply at the Medicaid office, and you have until the end of March, which is Monday, March 31st, to apply. If you fall between 133% and 155%, then there are going to be some subsidy credits and some other notes that you'll need to follow. If you're over 200% in the poverty level, Texas did not expand the Medicare expansion. So if you fall between 200 and 400%, you are more than likely going to go in for a private HMO PPO plan. What happens if an individual does not want to purchase a health insurance plan? They will end up having to pay a penalty in the form of a tax. The first year of the implementation is 2014. The fee is going to be either $95 or 1% of your income, whichever is greater. These are the things that you're going to file on April 2015 for your 2014 taxes. Now, please note that open enrollment for 2015 is going to be November 15th through December 15th, 2014. In 2015, if you still do not have your health insurance, the fine will increase to $695 per adult and $347.50 per child, or up to $2,085 per family, or 2.5% of your income, again, whichever is greater. And that's what you're going to pay on your 2015 taxes when you file it in 2016. So please note that there are some dates on here that you are going to need to take note of. High deductible health plans is an option. A healthcare plan that charges you a lower premium and has a higher deductible than traditional healthcare plans. Often, small business owners find that a higher deductible health plans are more cost-effective in a way to provide health insurance to their employees. We're going to take an example that we did in January 7th, 2014. This is someone in Houston, 77083, one male, 54, non-smoker. And we're going to take the bronze through the gold plans. The platinum plan is not covered by Blue Cross Blue Shield. They do not offer it, but they do offer a couple of different gold plans. We're going to start with the $6,000 deductible. You have a $6,000 max out-of-pocket. You have 100% coinsurance, but on the bronze plan, you don't have any coverage for a copay for a doctor office visit. That means you're going to pay out-of-pocket for that doctor's office visit. And for this particular male, the monthly premium on that is $280.18. Now, I'm going to go back over that one more time. Because you have no coverage on prescriptions or doctor office visits until you have met your deductible of $6,000. These deductibles are in a calendar year. They run January 1st through December 31st. So January 1st of the following year, they start all over again. Let's take the silver plan. It has a $3,000 deductible, $63.50 because this is an individual out of pocket, 100% coinsurance. Now we add in that there's a $35 office visit copay. Now the premium is $409.69. Okay, these are all also on HMO plans, which means it's a health maintenance organization, which means you need to select your doctor and go through that doctor's chain. We do have a PPO listed below. On the Gold Blue Advantage 007, we lower the deductible to $1,000. Your total out-of-pocket is $3,000. You have 80% coinsurance. Your doctor office visits are now $30, but your premium is $509.49. Now, we have a new one that says a $0 deductible, a $6,000 max out-of-pocket, 100% coinsurance, $30 office visit, but you're paying $615.69. Now we're going to go to the PPO plan, which means you can pick any preferred provider organization that accepts the Blue Cross Blue Shield Blue Choice plan. You have a $1,000 deductible and a $3,000 max out-of-pocket, a $30 office visit, and your premium is $651.36. Now we're going to take it and do the same thing, same plans, on a male, 26, also living in Houston, and a non-smoker. So we have premiums, monthly premium for $134.38 to $312.41. I'm going to take it another step forward, and this is going to be for a family of 3, a 54-year-old male, 51-year-old female, and a child that is 25. Your Blue Choice Gold PPO plan, which will give you the same $30 office visit, $1,000 deductible, $3,000 for the family, a $3,000 max out of pocket, is going to be $1,526. The silver plan is going to be $960, and the bronze plan is going to be $656. Now I'm going to start talking to you about American Workers Insurance Services. This is where the indemnity plans and the association healthcare plans are going to come in. Been a licensed insurance and registered insurance agency in over 40 states and 2 territories, District of Columbia and Puerto Rico. AHCM was established in 1983 by a group of doctors to market affordable association healthcare benefits. Willie Martinez, who happens to be the Executive Vice President of Marketing, has over 20 years as a licensed insurance agent and also happens to be a very good friend and a mentor. Has put some of these slides together for us. American Workers Insurance Services, also known as AWIS, has an A+ rating with the Better Business Bureau. Limited group health and dental insurance benefits. The association program has been in business for over 30 years. American Workers Insurance is a licensed insurance agency providing group health, dental, life insurance, and discount benefits to our association members. The association, as I've described already, has group health, dental, and life insurance. We have discount programs also. There's free resources and quality support. You have 24/7 access to your plan information online, as well as phone support from your representative or from our customer service team. We are not your average healthcare company, and here's why. Everyone is accepted. No medical restrictions, no occupational restrictions, no cost increases, 30-day money-back guarantee, nationwide provider network, no U.S. resident ever denied. You can enroll today and start saving. We're going to talk a little bit about the doctors, labs, hospital, and surgery indemnity plans. We start out small and we add to our packages this way. We have one of the world's best hospital patient advocacy programs called PAC. It's one of the things that we are most proud of is to be able to give our members a line-by-line item review of what their hospital bills are. So you're going to find the PAC program is going to be in 90% of our programs because it's something that we offer our members as a service. $50 office reimbursement up to 5 times a year, sickness or accident, listed in the states that are available. We start out at $49 a month, $69 for an entire family. We also have, if you're just worried about going into the hospital, $1,000 regular, $2,000 a day ICU, CCU, up to 31 days in a calendar year. We can add in the doctor office reimbursements by going to the next plan, which is the blue plan, hospital plus PAC plus doctor office visits. We can also add surgical benefits. Anytime you're having a surgery, you're always going to have an anesthesiologist. So in this next plan, we've added the anesthesiology benefit, labs, x-rays, radiology, and imaging. In the next set of 4 plans, we've just added a little bit more to each benefit. You have the $50 office reimbursement, 5 times a year, sickness or accident. Now we've added a $50 office reimbursement for a wellness exam. The $50 lab and x-rays, $50 wellness lab and x-rays, and $150 towards radiology and imaging. We're going to move over to the green plan, which is the hospital plus surgery plus labs and doctor office visits. So the next one is the Deluxe Medical 1500, which is going to give you the hospital inpatient, outpatient surgery, inpatient, outpatient anesthesiology, doctor office visit reimbursement, wellness doctor office reimbursement, $50 on labs and x-rays, $50 on wellness labs and x-rays, $150 radiology and imaging, and of course our PAC department. And then we're going to go to the blue plan, which is going to give you the $1,000, $2,000 ICU, CCU, $3,000 inpatient, $1,500 outpatient, $600 inpatient, $300 outpatient anesthesiology, $75 labs and x-rays, $200 radiology and imaging, $50 office reimbursement, and of course our PAC department. Understand what we also offer is concierge medicine, so if you need to find a provider or a facility, we can also handle that with our customer service department. Remember when I started this discussion, we were talking about the dental. Dental is available for children but not available for adults under the Affordable Health Care Act. So now we're going to talk about our dental HMO plan. There's no waiting periods for any pre-existing conditions. We have the largest dental network in the United States with over 189,000 dentists. They've been in business since 1954. All active duty military members have these dental plans. No health questions, no age limits, and we already service over 25 million customers. So we're going to give you a sample of our copay schedule. Detailed oral exam is at no cost. X-rays are at no cost, ever. Office visits are $5. Teeth cleanings are $5. Now, if you haven't been to the dentist in a while and you need a little extra deep cleaning, it's not going to be $5. It is going to cost you a little bit more. Fillings are at $8. Tooth extractions are $10. Root canals run between $165 and $365. Crowns go from $185 to $395. A complete denture set is $365, and braces for a child is $1,900, and an adult is $2,100. You can find the full description of benefits and copays at the website listed below, which is meg.awisdental.com. Now you're going to ask, can I afford this? In most states, it's $39.95 a month for a single or $89.95 a month for an entire family. Please note that some of the benefits from state to state may vary. I want to thank you for joining us for a few minutes to understand about affordable health care and going forward in 2014. If you would like to have a Blue Cross Blue Shield quote, you're welcome to go to www.workingwithmary.com. If you'd like to see more about the indemnity plans, you may visit meg.awiscard.com. If you'd like to just see the dental benefits, you can go to meg.awisdental.com. And at any given time, you'd like to give me a call, 832-851-5466. I'm looking forward to working with you. If you have any further questions, please don't hesitate to give us a call. Have a wonderful day. Thank you.